Nursing union DENOSA says South Africa is not ready for phase 2 of the vaccination program on Monday. This program is intended to vaccinate those over 60 years. While more than 455,000 healthcare workers have been vaccinated in the country, more than 210,000 have been left in the lurch. The Provincial Secretary for the Democratic Nursing Organization of South Africa, DENOSA, in Gauteng Bongani Mazibuko, joins us now via Zoom to tell us more about their concerns. Mr. Mazibuko, a very good evening to you. Thanks for joining us. Welcome to the Globe.
Good evening and thank you for having me.
Now, we've heard Dr. Zweli Mkhize and as well as the various health MECs of the different provinces articulating their province's state of readiness to implement phase 2 of the COVID-19 vaccine rollout. Are you still holding the same concerns with regards to, the readiness of the nursing staff?
Definitely. We are basing this on the fact that on the 7th, not so long ago, Gauteng Premier went on and said that there's a number of sites that have been highlighted and they're ready. And now we come today, there's a lesser number of vaccine sites that have been that are going to be opening tomorrow. And secondly, we also saw the queues between Wednesday and Friday of healthcare workers queuing to get inoculated with the Johnson & Johnson vaccine. And those people have been left in the lurch. We are saying now that tomorrow they must then go, and they're still waiting for SMSs. Those SMSs are supposed to come out today. That is totally inefficient. People are supposed to be going to work tomorrow, and then at Minister you have to reschedule and so forth. So that to us as Gauteng, DENOSA in Gauteng, it tells us that the department is definitely not ready for tomorrow's rollout.
Okay, so what's your ideal strategy with regards to the vaccination rollout?
What should have ideally happened is that, firstly, I think the department's vision to inoculate or to vaccinate 40 million people by the end of the year is but that a vision. And we don't think it will be able to deliver on that. And secondly, the department does not have enough manpower. There is a shortage of nurses. This is something that we have always advocated for as at DENOSA. So now you then need to make sure that you partner public and private sector to work together. And secondly, they need to make sure that there's enough information that goes out there. And another thing would be to make sure that the people who are supposed to roll out this vaccine, which is the nurses, they are the people who are knowledgeable and they are able to share information with them so that they are ready to be able to assist the department in making sure in making sure that the vaccine rollout is successful.
So what's your analysis then of the capacity of the nursing staff with regards to training in implementing the vaccine rollout?
The failures is at the departments, though. There is a shortage of nurses in this country, and that is an open secret. We have been calling out the department on this matter for years now, and nothing has been done. The only thing that the department has done in recent times due to COVID was to contract nurses, to put nurses on contract so that they can assist during the COVID period. And as I speak to you in Gauteng, we've got nurses who have not been paid for 2 months, the community service nurses, who have just been employed in the department. So we need more nurses, and then we need to make sure that the facilities that are being earmarked to be vaccination sites, they are prepared and those facilities are up to par, which is not the case in this case, at the moment.
Let's talk about the mental wellness of the healthcare workers, because I suppose that is one sector that has been largely overlooked with regards to carrying out the mandate of fighting COVID-19. And, it takes a huge toll on their mental health. Do you get a sense that all the nursing staff in South Africa are well capacitated, mentally speaking, to deal with the carrying out the mandate of fighting COVID-19?
Well, they might be capacitated in terms of being able to carry out the mandate against COVID, but COVID, like most diseases, would actually take its toll mentally on anyone, because you see so much death and you see so much adverse events happening. Most of the nurses have lost their loved ones and they've lost staff members. So we need for the department and for everybody who's involved to actually up the support in terms of mental health assistance. We need to have counseling programs in place, and we need to make sure that those programs which are there that are being offered to the nurses, the people have knowledge about them. It's no point in having a counseling program, and yet that program is not being rolled out, or the people do not know that we've got such a service available to us.
Unions have been lamenting that not all hospitals and clinics are taking steps to protect, the high-risk staff from coronavirus. So what's your thoughts on this matter?
Yes.
Have the unions raised this to the relevant authorities?
Yes, this is something that we have raised previously. We've actually had engagements with the MEC of Health, Dr. Mokgethi, and we are echoing those sentiments. Firstly, it was the PPE scandal in Gauteng, where there were shortages of PPE, and then after that we had challenges with the standard of the PPE that was being given to people being given small sizes, or in other places no sizes being available. Then there was the issue with the quality of the masks that were given to people. So it's not a new thing. We are still having those challenges. And during the Johnson & Johnson vaccination trial, we had people who are working in clinics, which are at the forefront of COVID-19, being told that they are not frontline workers. They cannot therefore be inoculated. So those are some of the challenges that we are saying, we are talking about when we say that the department is not doing enough to protect the frontline workers.
Well, are you at liberty then to track which hospitals and clinics and all health facilities are not following the COVID-19 guidelines and rules for purposes of, imposing certain sanctions and ensuring that everybody sticks to the rules?
Well, I would not want to go that route for now, but the department is aware of those institutions. We have submitted the names. I would call on the department to be the ones to go public, because we have brought it to their attention, and I would not want to be at the moment to be seen as if I'm grandstanding. But this is about the healthcare and well-being of the nurses on the ground.
All right, and just picking up on that point, on the health well-being of nurses on the ground, we've seen Gauteng declaring that it is officially in the third wave of the coronavirus infections, and heaven knows which province is next with regards to the third wave. So are you getting a sense then that the nursing staff has heightened its preparedness for the third wave?
Yes, we have. As nurses, we have heightened our preparedness for the third wave, but unfortunately, the ball is in the hands of the community as well. I think many speakers have said it, and even the ministers touched on this, to say that even though we are in the middle, or we are starting the vaccination campaign, people still need to practice social distancing, washing of hands, and so forth. And what we are seeing at the moment is people have actually taken a step back from doing that. People go into shops, they only sanitize their hands when they get into shops. While if you walk around in the townships and so forth, people are not wearing their masks, there is no social distancing, and people are carrying on with life as normal. So we need people to be aware that they still need to take those precautions in order for us to be able to prevent the spread of COVID. And yes, the nurses will do their utmost best, as they have since the beginning of this pandemic.
All right, Mr. Mazibuko, great chatting to you. Thank you so much for your thoughts on this matter. That was Bongani Mazibuko, the Provincial Secretary for the Democratic Nursing Organization of South Africa, DENOSA.